Good day, everyone, and we are the Group 8 presenter. And before we start, we would like to introduce ourselves first. So, I am Angelique S. Papa, together with Art Ben Arlante Jr. and Francine Sara Casania. Today, we will explore the significant topic entitled of Other Health Impairment. Here are the objectives that we'll discuss by us. So, first and foremost, let's define the other health impairment. Definition of idea and other. In the idea defines other health impairment or OHI as having limited strength, vitality, or alertness. Adversely affects a child's educational performance. These conditions may affect the everyday life of a child, especially to their studies, so that they need a special support and supportive environment to help them to cope with their conditions. In special education, it is refers to the condition that can affect a child's health. So when we hear the word other health impairment, it emphasizes that there are a lot of different characteristics of health impairment that we should learn and be aware of what might students have. Types of other health impairment. So we have asthma, attention deficit hyperactivity or ADHD, diabetes, epilepsy, heart conditions, hemophilia, leukemia, cancer, and Tourette's syndrome. First is asthma, a chronic lung disease that causes airways to swell and narrow, making breathing difficult. Asthma is a common disease in children and adults. There are many factors of causes of asthma, including pollution, physical activities, stress, extreme emotion, and occurrence of mucus in the lining of our airways. It results nga nabulian kita magginhawa. So as asthmatic student, it's very hard for us in terms of our education because we cannot all fulfill the given tasks or performances, especially physical activities. As you can see on the picture, asthmatic person can use inhalers and nebulizers to treat and help them may feel better. Attention Deficit Hyperactivity Disorder or ADHD. Mostly sa mga bata ni siya nag-occur and they are so very hyper, impulsive, and careless sa ilang mga actions and wala sila nag-think kung ano ang maging consequences. So kumbaga kung ano ila gusto, himuon gid nila, kung anong ila ikwaon, kwaon gid nila. So these people are also they are inactively or mabudlay gid kwaon ng ilang mga attention. Diabetes. So meaning sa tao perspective natin is taking too much sugar, too much sweets are many factor of diabetes. So there are two types of diabetes. First is type 1. The immune system attacks and destroys the insulin producing cells in the pancreas. So that the body can produce the insulin itself and it is occurs sa mga bata and nag-trigger it through environmental factors. So the type 2 is the body cells become resistant to insulin and or the pancreas doesn't make enough insulin. So the body becomes insulin resistant means nga ang body nag-produce ng insulin but cells ng body naging resistant or wala nag-respond so that ang glucose or sugar naton gina-take wala naga-enter sa cells so nagakos ang diabetes. Both of them gina-treat by medication including monitoring devices and insulin injections. Epilepsy. It is a structural abnormality sa brain sang tao that causing of unconsciousness, nga gulpi lang nakuyap, or malipong. It is due of several factors including genetics factors, infectious disease, brain injury, and development disorders. Heart conditions, congenital present from birth or acquired defects that impair the heart's function. So there are several types of heart conditions. So we have atherosclerosis, is thickening or hardening the arteries caused by an buildup of plaque in the inner lining of an artery. So when student maka-experience ng high blood pressure and maybe increasing of their cholesterol level. Heart valve disease. As you can see in the picture, ang lining sang heart is nagakipot, in results ang blood nga nagaflow, hindi maayo ang iya pag-process sa aton heart. So, that's why mabudlaya ng tao sa pagginhawa. The cardiac arrhythmia is irregularities in the heartbeat. The beat of the heart don't work properly, and also the heart may beat too fast and too slow. So nowadays, many of students are fans sa kape, mahilig sa mga foods nga hindi maayo sa ating health so that sometimes they get a palpitate. So this condition can fall to cardiac arrest and heart attack. Heart failure. So it is impairment of a heart that muscle doesn't pump blood properly. So heart infectious. It is due of fatigue, chills, fever, and chest pain. Hemophilia. It is a rare inherited bleeding disorder in which the blood doesn't clot normally. So it happens when the platelets and clotting factors or organ na nagapugong sa aton mga pilas is hindi mag-function. Ang tendency is ang pilas maski gamay man or dako, hindi gid ang blood hindi gid mag-untat sa pag-flow. So it also happens nga maski gamay-gamay lang ang atong paghulag or bunggo gaagi gid siya dayon sa aton nga skin. Leukemia, cancer. Cancers of the blood, leukemia, or other chronic illnesses that affect energy and attendance. So this is the one of the common cancer in children younger than 15 years old. It happens when the starts of making too much of abnormal white blood cell than the healthy one. The tendency is the body is hard to fight. The body infects you so that why nga weak sila and need good for special treatment and medication. Lastly, Tourette's syndrome, a nervous system disorder involving repetitive movements or unwanted sound or tics. When we say tics, it is a sudden repeating words and actions that was involuntary or hindi nilangon. So if there's anyone here are familiar with this movie, is a good example of a student with Tourette's syndrome. So as you can see, it is not easy to handle their condition. So this condition, they need a space, separate rooms, and special support in terms in education, where they can learn, concentrate without interrupting others.
Characteristic of children with other health impairment. Fatigue and limited stamina can significantly impair concentration, memory, and overall cognitive function, leading to lower grades and academic struggles. Frequent and extended absences. Being in school helps you learn and do well. Missing school makes it harder to learn, which can lead to lower grades and feeling bad about school. Attentional issues. Sometimes, especially if you have ADHD or if you're taking certain medicines or if you're not feeling well, it can be hard to concentrate. Keep your mind in one thing. Pay attention to what you're doing. Complete your works or chores. It's like your brain is a bit fuzzy and it's hard to get things done. Side effects of medication. So imagine someone has a headache, so that's the symptoms. They take medicine to get rid of the headache, but the medicine makes them feel sleepy and unable to focus. So the side effects. So while the medicine might help with the headache, it creates new problem by making it hard to concentrate and stay awake. The original headache symptoms is now compounded or made worse by these new side effects. Motor or coordination difficulties. Some students may need adjusted physical activities or movement support due to health, physical, or developmental conditions. The goal is to make physical education inclusive so every student can safely join, learn, and have fun in ways that fit their abilities. Common learning characteristics, inconsistent performance. This refers to student grades and understanding of the subject matter fluctuating. They may perform well on day one but struggle next, even with seemingly similar tasks. Gaps in knowledge. This indicates that a student is missing fundamental information. This makes it difficult for them to understand more advanced topic because they lack of necessary building blocks. Organizational challenges. This involves difficulties in managing time, materials, and tasks. Students may struggle to keep track of assignments, notes, and headlines, leading to disorganization and decreased academic performance. Need for self-management skill. This highlights the importance of students developing skills like goal setting, self monitoring, and self regulation. These skills help students take control of their learning process and improve their overall academic success.
So, the next slide is inclusion, accommodation, and adaptations in the general education setting. So, first is the physical and environment and access. This means nga ang students is mas prepare nanda nga magstay sa isa ka specific nga spot or sa classroom nanda like sa near ka door or away from distractions. Tapos they may also need breaks to move around and access a quiet place for medical needs or to rest. So just like in the pictures is ang room nga small space lang for students nga mas prefer nanda ang away sa distractions or access nga place nga diin nga may medical needs nanda or gusto nanda mag-rest. So next is instruction and assignments. This means is adjusted workload or pacing, extended time for assignments or tests, modified tests, or use of a second set of textbooks at home, note-taking assistance or access to teacher notes or recordings. So, ang ginbutang ko nga picture is teaching strategies. So, amo dan ang ginbutang ko dan kay amo dan ang do assistance para sa mga students or notes sa mga teachers kung paano nanda tudluan ang student nanda para maka-help sa understanding kag retaining information do para masapos do lang para kananda ang pagtudlo sa mga students nga naobrahan nanda kang test or assignments. Next is attendance and miswork, meaning homebound instruction or virtual learning options for extended absences, designated peer or staff member to collect miswork and provide support upon return, flexible deadlines and the system for making up work. So, sa picture is, ang student, may medical needs nga kinahanglanan da mag-absent for a long time, they can learn from home with the teacher's help. So, nakita natin is dyan ang bata sa balay nanda, tapos ginakadto na, dyan man ang teacher sa tupad nanda para magtudlo ka nanda para sa mga na-miss nanda nga works or to make up classes kang mga assignments nga aransiran nanda. There can be more time to complete work and a way to catch up on what was missed. Next is behavioral or attention, meaning clear, consistent routines and expectations, visual aids, breaks and opportunities for physical activity for ADHD, positive reinforcement and behavior intervention plans as needed. So, ang ginbatang ko nga picture is intervention plans to help kang mga individuals nga makaintindi kung ano ang behavior nga ma-expect natin kag paano ma-improve ang behavior kang mga may ADHD. So, sa paggamit sa visual aids is like ang sa picture nga dan like charts or schedule nga maintindihan natin kag maobra nga mas better ang task nga dan.
As we end our lesson for today, let's be reminded that health impairment doesn't define a student's potential. It simply defines their needs for support the health, support the strength, and empower the mind. So thank you very much for listening, and God bless us all.